A AAA stands for abdominal aortic aneurysm. An aneurysm is where you have a dilation of an artery, in this case the abdominal aorta. The problem with aneurysms is that they can develop some clot and get bigger, and like a balloon, if they get too large, they can burst, they can rupture, causing life-threatening bleeding. Most aneurysms are asymptomatic, and that's what makes this difficult to treat. When aneurysms become symptomatic, that means they're either ruptured or likely impending rupture. Symptoms that people feel are severe abdominal, back, or flank pain. Sometimes that pain can radiate down into the groin or even the scrotum. The only treatment for an aneurysm is surgical. The old way, the classic way, is to do either a large incision down the abdomen or over on the side, go in, open up the aneurysm, and place a graft through it to replace the aorta. Currently, we have endovascular techniques, or techniques that go through the groins, and we can place what we call an endovascular aneurysm repair. This is an aneurysm that sits in the body like this. These are the arteries going to the kidneys. This is the aneurysm in the aorta. You can see that's ballooned out, and these are the arteries going to the legs. What we do is we have wires coming from the legs, coming up into the aorta, and then we deploy this stent graft, which just holds itself right below the renal arteries and comes down into the arteries that go into the legs. And what this does is blood is forced through the stent and does not come out here in the aneurysm. When this clots, this sac will shrink around the stent graft, and the aneurysm is fixed. Well, there's still studies to figure out exactly what is causing these. It's a weakness in the wall that causes it to thin out and get larger. What we found are the risk factors include having a family history of these. There's certain connective tissue disorders such as Marfan syndrome that can cause this. But the number one risk factor we found is smoking. Male gender and age are also very strong risk factors. We're still figuring out exactly how screening should work. However, we found that adult males who smoke should be screened with a one-time ultrasound after the age of 60. And the Welcome to Medicare package actually offers this. And the way we screen is with an abdominal ultrasound. The aneurysm can be seen, and if there is a large aneurysm, it can be further evaluated with a CT scan or an MRA. If patients do not have an aneurysm on that ultrasound, odds are very strong that they will not have a problem with an aneurysm, as these develop over the course of years, and it is unlikely to develop it if their screening is negative. Other people who may require screening are children of people who've had aneurysms or have known family history of aneurysms, especially those of women who've had aneurysms, since it is much more common in men.